My name is Faina Shtern. I'm a physician and founder of the AdMeTech Foundation. I'd like to express my gratitude to the NAACP NEAC and multiple Massachusetts branches for your partnership since 2015. AdMeTech Foundation provides leadership for the groundbreaking programs in prostate cancer at the state, national, and international levels. Our programs have been transforming patient care for everyone and reducing health disparities in Black men. The goal of my talk is threefold. First, to provide a brief progress report for our joint prostate cancer awareness program. Second, to review recent and exciting advances in screening, diagnosis, and treatment of prostate cancer that are particularly relevant to Black men. And third, to describe our prostate cancer equity program launched last year to bring these advances in patient care to every man in Massachusetts and eliminate health disparities. Prostate cancer equity program is an integral part of the AdMeTech's ongoing statewide program in prostate cancer that created a Massachusetts model of national leadership in public awareness, medical education, and research. We are grateful to many Massachusetts legislators who made this program possible. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. Since 2019, our public awareness and education program reached over 39,000 individuals. This program was initiated since 2009 in collaboration with multiple organizations and has three components: public awareness, community education, medical education, and research. Public awareness and education, our messaging centered on the importance of screening and early detection, critical for saving lives. Early detection is particularly important for Black, including Hispanic men, who are 2.5 times more likely to die compared to white men. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive during the same period of time. Together with NAACP NEAC and its multiple Massachusetts branches, we had reached almost 14,000 people since 2019. More than 7 years ago, at the September 2015 annual meeting of NAACP NEAC, we expressed our concern about Plymouth County, which led the state in Black mortality. At that time, health disparities in Plymouth County in prostate cancer were higher than state average as seen in these blue columns. Indeed, Black men were 2.5 times more likely to die compared to white men. Following that annual NAACP meeting, in 2015, we formed partnership with Brockton NAACP to initiate a broad community engagement and large-scale public awareness campaign. It has been supported by the Good Samaritan Medical Center. By 2021, as seen in this red column, we saw over 50% reduction in disparities compared to 2015 in death rate between Black and white men, reaching near parity. At this time, Black men are only 1.2 times more likely to die compared to white men in Plymouth County. This is a disparity rate which is much lower compared to state average. During the same 6-year period between 2015 and 2021, there was no reduction in disparity in death rate at the state level in prostate cancer. The center of our medical education is AdMeTech's annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. The latest annual conference took place last year. Our summit brings experts representing every clinical expertise to review the best emerging clinical practices. This educational event showed rapid advances in patient care. In screening, our summit supports clinical guidelines for early detection recommended by the National Comprehensive Cancer Network, consisting of over 28 cancer hospitals and their leading experts. High-risk men, including men with Black heritage or family history of prostate cancer, are recommended to start screening with PSA blood test at the age of 40. Average risk men should start screening at the age of 45. This first, or what we call baseline screening test in younger men, has emerged as one of the most important indicators for identifying men at risk of life-threatening prostate cancer long-term, over 10 years. In diagnostics, we have seen emergence of very accurate non-invasive tools, such as blood, urine, and saliva analysis for molecular and genetic markers, and advanced imaging, including ultrasound, MRI, and molecular imaging. This non-invasive diagnostics highlighted the importance of PSA screening and shifted past concerns about screening into a dustbin of history. For example, these diagnostics can determine which individual man has an increased risk of life-threatening, rapidly progressing prostate cancer, improve early detection critical for saving lives, reduce unnecessary procedures such as biopsies and treatment, and optimize selection of personalized care for each man, including careful observation, or what we call active surveillance, minimally invasive interventions, or immediate radical treatment. High-risk individuals, including Black men, carry higher risk of both mortality and unnecessary procedures. Consequently, it is critical for them to have access to precision diagnostics that determine for each individual man if he should or should not have invasive biopsy or treatment, and what options in clinical care are best for him. Unfortunately, in Massachusetts, compared to white men, Black men are less likely to have precision diagnostics such as advanced imaging, molecular or genetic testing, and to undergo life-saving treatment. Prior to undergoing invasive biopsy or treatment, it is important for each man to discuss with his doctor if any testing is available to determine if these procedures are actually needed, and if yes, what kind of options would work best for him. For example, in this slide, MRI shows prostate cancer lesions and guides biopsy needles with precision. AdMeTech has led research, development, and large-scale clinical implementation of prostate MRI since 1998. Our summit highlighted the importance of MRI in Black men who are likely to have lesions in the front part of the prostate that are difficult to reach by physical exam or standard blind biopsies performed without accurate imaging. In men with prostate cancer, there are two pillars of the current diagnostics, MRI and genetics. While MRI shows cancer location and local spread, or what we call stage, genetic analysis of cancer tissue reveals underlying biology and probability of cancer progression. With this precision diagnostics, we can now accurately determine if each individual has a slow-growing, harmless cancer and needs only careful observation or minimally invasive procedures, or an aggressive prostate cancer requiring immediate life-saving treatment. More recently, molecular imaging has been shown to play an important role in staging of prostate cancer, including presence of metastatic spread and detecting return of prostate cancer after treatment. For example, molecular imaging has been approved by FDA within the last 2 years and become available at the Dana-Farber Cancer Institute since August 2021. On the left here, we see a traditional bone scan imaging showing no metastatic spread. On the right, Molecular imaging demonstrates extensive metastasis. This information is important for selecting appropriate treatment. We are proud to have led research and development of molecular imaging since 2001. Our summit concluded that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high-quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Program in 2022 in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care. Supporting organizations include Latino Health Insurance Program and NAACP New England Area Conference with their multiple branches located across the state. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today. This program helps men to find an expert for their initial or a second opinion in person or virtual visits. Any Massachusetts man aged 40 and older can take part in this program. Our priority focus is on Black, Hispanic, and Latino men who are at higher risk of prostate cancer, delayed diagnosis, poor quality care, and death. We believe that in Massachusetts, with its leading hospitals and universal access to care, our prostate cancer equity program will be able to eliminate health disparities. Experts of the prostate cancer equity program can address any questions about prostate health, from assessing an individual healthy man's personal risk of prostate cancer to informing men about all available options before and after screening, biopsy, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined VIP-style process of patient referral and care, reflecting how doctors involved in this program take care of our families and friends. This process consists of three components. First, AdMeTech Foundation's coordinator and counselor collect basic information and match individual patients' needs with the appropriate state's experts. Second, a clinical organization designates a patient navigators who work with multiple schedulers to expedite medical visits. If an expert recommends any next steps, AdMeTech's coordinator, counselor, and patient navigator work with men on the appropriate follow-up, such as, for example, further testing or treatment. To ensure successful implementation of this program, AdMeTech has created a network of leading state experts committed to eliminating health disparities, developed an effective process for patient care and follow-up, as mentioned, recruited multiple community coordinators in high-risk areas who in turn mobilized a network of over 75 program ambassadors, community, organizational, and church leaders, and held multiple focus groups to develop program materials. Our current goal is to identify and mobilize appropriate organizations and individuals so that men, their primary doctors, and caregivers have access to this program. Trisha Kinney, a member of the AdMeTech Foundation staff, serves as a statewide administrative coordinator and the initial point of contact for the Prostate Cancer Equity Program. Ronald Green, a registered nurse and member of the New England Region Black Nurses Association, provides education and individual counseling. Ron has more than 40 years of clinical experience and service to Black communities. If you have any questions or need assistance, please contact Trisha by phone 617-523-3535 or by email coordinator@admetechfoundation.org. Thank you for your attention.